Hey, this is Different Careers again with Kate Nudd. So today we're going to do another continuing education class review. Again, ABMP hosted it. And this is again the class is called Manual Lymphatic Drainage, Basic Techniques for the Neck and Face. This is like part 2 of a series by Nicola McGill. I think this is the last one. So let's get an overview. So for 2001 to 2023 renewal period for Florida only, they said this counted as distant learning as a hands-on technique, but it was for Florida only. So for New York, this doesn't count as a hands-on technique for New York. You're just getting 1 CE hour. So gain an understanding of manual lymphatic drainage movements and the location of important lymphatic structures as you watch Nicola McGill's dynamic demonstration of the 3 MLD techniques and MLD sequences for the neck and face. Learn about this important modality that, when provided effectively, can support and enhance the movement of lymph fluid through the lymphatic vessels and eventually back to the cardiovascular system. Oh, and I did not do my evaluation yet, so I'll have to do that later. But after the class, you get to evaluate your instructor to be like, is this beneficial in your massage practice, or would you apply this to where you're working as a massage therapist somehow? So those were the course outline. Learning objectives: describe how lymph is transferred through the lymphatic collectors, list the 3 techniques used in manual lymphatic drainage, identify the common characteristics of manual lymphatic drainage, identify lymphatic pathways of the neck and face, list the steps in the manual lymphatic drainage sequence for the neck, and list the steps in manual lymphatic. Sorry, I'm trying to figure out how to get this to see better. So, there, that's better. Sequence for the face. Nicola McGill has over 25 years experience in the field of massage and bodywork, both in the US and the UK. She is a manual lymphatic drainage certification program instructor for class training and consulting. In her clinical practice, Nicola utilizes her skills as an aromatherapist, massage therapist, MLD practitioner to treat a wide range of chronic and acute medical conditions, including those related to the respiratory, digestive, muscular, skeletal, nervous, and reproductive systems. She is an oncology, massage, and lymphedema therapist at the Boulder Community Hospital and a team member of the Boulder Cancer Survivorship Program at therapy, where she provides lymphedema education and restorative and comfort-oriented bodywork treatments for individuals who are undergoing or have completed treatments for a cancer diagnosis. So learn more at nicolamcgill.com and closetraining.com. So that is the objective. So let's get into watching a portion of this video, and then I will give my review of the rating. So, and we're just gonna watch a minute or 2 or something like that.
When I'm really close to the midline, but as I move further away, I'm performing those at the same time, and you can see I'm working on that lower jaw here, taking all that fluid out to the angle of the jaw. And the same thing, I want to make sure that continues on its journey down towards my supraclavian supraclavicular fossa. And then from here, we're going to kind of think about working on the upper jaw, and we can work on that area that's between the lip and the nose. And again, you're just going to come down to the pads of your finger here. Same concept, pressure phase, relaxation. Pressure on, pressure off, pressure on, and pressure off. I can do that several times. And then as I move further away, you can see here now I have the space to bring my fingers and hands into the full movement of this sequence. Again, I'm taking that fluid out towards the angle of the jaw. Now, here you can see me, rather than staying in one place and doing 5 to 7 times in one place and moving, that's absolutely perfectly fine. Sometimes you can do it where you're just constantly traveling. So sometimes, again, I just choose differently according to what I'm working with. But you have the option of staying 5 to 7 times or continuing to travel. And then again, same thing. I don't want to keep it in these lymph nodes. Let it go down to its final destination, which is the supraclavicular fossa. And we can now work a little bit on the nose. Now, the nose is something that not many people are used to working on, but it's really good to work on the nose, especially if you've got somebody that's got congestion, allergies, or they've had surgery to the nose or the surrounding area. And again, we just kind of use 1 or 2 fingers, and here we alternate. And it may look like I am squashing the nose, but I'm actually not. I'm stretching the skin on the top. So I'm just going to take one hand away so you can see a little bit more clearly the connection to the skin, stretching in the desired direction, and then releasing it. And this is one that we do. We can work at the tip of the nose, and then we gradually work all our way up to the bridge of the nose. And this can help start stimulating those deeper sinus responses. And then from working on the nose, I'm then ready to move on to the cheeks. And as a reminder, those cheeks drain down into those submandibular lymph nodes. So from here, I'm going to just place, I'm not putting any pressure on the top of her head. It's just me resting my fingers on the top here, and I'm just going to perform those stationary circles, pressure on, pressure off, and you can see hopefully how I'm moving that fluid in the direction of the collectors that lead to the submandibular group of lymph nodes. And again, make sure you want to cover the entire face. So start thinking about things like when you're doing MLD on the face, what conditions you can help be supportive with, like
Okay, so this, like the first part 1, it didn't go over my head as much, so I rated it as a C. This one I'm rating as a D. Here is why. So I don't understand the manual part of lymphatic drainage as far as like light pressure technique, because she was saying you work way more superficially, so I don't understand like the pressure gauge of light of what she's talking about. So I would need like hands-on training to actually learn this technique with like instructors in an actual classroom where they're demonstrating the technique, letting me practice, then have themselves be on the table and then feel if I'm getting the technique right, to be able to learn it. So like she was showing different techniques and stuff, and I tried to do them on myself, and I'm just like, I have no idea if I'm doing this right or not. So to me, like someone who is in school for lymphatic drainage, for some reason, if it wouldn't make sense, but for some reason, if they needed a continuing education course, or they've already done this and they need more continuing education courses, this would be a good one for them, because it would be like a reminder of like, remember how to use these techniques. It's not a good one for me because I know Swedish skills, I know deep tissue or treatment skills. I work from light to firm pressure mostly now. I have done deep pressure in the past, but it's like it it's like at some point you're like, if you don't feel the muscle tension change when you're doing deep pressure, you're like, why am I going to spend my time and energy doing deep pressure anymore when I don't feel your muscles actually loosening up from deep pressure techniques? So that's why I took it off my thing of, so I work to light to medium and medium to firm pressure only right now. But at the spa place of business that I work at, I'm locked in as light to medium. So, but I have been kind to clients and I'm asking that question. And the main thing is I'm trying to limit energy drain, because it is very physically demanding, giving like 4 to 4.5 hours of massages of day, and then you don't really get a break in between clients, because you really need to talk to clients in between appointments to like really understand what type of massage that they need or want, or what they want to get out of the massage. Because if you don't have that conversation, you can't just like put them on the table and be like, yeah, I'm giving you the massage you want. So I gave it a D because the hands-on stuff went over my head. I did pass the quiz the first time. It was a little over an hour. So, I mean, technically, you could give it a C, but the problem is, like, if you don't understand the material, if you can't apply it to like your everyday career, how can I really give this a C? I can't apply any of these lymphatic drainage techniques to my practice because I need an instructor face to face to really be able to learn them. So that's why I'm giving it a D. That's the truth. But I was happy on that it took a little over an hour. And I was very happy that when she was talking, I got enough of the information, like that it's like she must have repeated enough of the information a bunch of times. It got into my head, so I passed the quiz the first time through right away. Very happy about that. So I feel overall like, hey, if you're just needing to get a continuing education credit and you don't care about using it, yeah, you get a C. But for me personally, I would like more continuing education credits where it's like, here's ideas of what you can do and how you can do different Swedish techniques, or different ways of massaging that feel relaxing, and people inventing different Swedish strokes or something, or here's more techniques of like we've invented different ways to do tapotment or a vibration, or I don't know, like here's ideas of how to move the stones in a different soothing way when you're doing hot stones or something like that. Or here's different ways of how to use a vibrator muscle tool on people. So, because like sometimes when you're at a spa setting, you're limited on what you can do. So it's like, where's more training on different Swedish techniques, or hey, you haven't gone to school in a while. Let's review Swedish techniques. Let's review how to do Swedish in different areas of the body, or how to work out knots in different areas of the body. So I can't use this because I work with different massage modalities. So it gets a C for if you are just wanting to get a continuing education credit and you just care about this, got done in about an hour, and you can pretty much not pause the video at all, and you pass the quiz the first time with a slow comprehension. So, but if you care more about information and actually being able to apply techniques to the practice, then it drops it down to a D. So I hope you enjoyed this video. Until next time. And again, there will be a written description in the comment section. If you have any massage therapy questions, feel free to ask them. Or if you're a massage therapist and you are in New York and you would like me to review a specific continuing education course that's certified for New York, please let me know. And through APMP, then I'm happy to do that. Or in the future, if there's certain massage videos, because I may take a break from doing APA continuing education classes for a while. If you want me to review massage videos done by other people, feel free to put that in the comment section too. So until next time.